You want to change that? 1720. Hello, everyone. Good morning. Great to have you all with us. We're going to go ahead and get started, and I think people will filter in here. Thank you for being here. My name is Alex Shannon. I am your facilitator today. I will also be presenting a little bit. I am the Deputy Coordinator of the Agenda for Change Consortium, and you will see a few of our members are here today, also contributing to this session. For those of you who are not aware of Agenda for Change, or maybe not as familiar, we are a consortium of like-minded actors and organizations, and we are dedicated to advocating for and providing evidence towards working collectively to strengthen water sanitation and hygiene or WASH systems. And given that aim, today's theme is on design and impact measurement, which is very relevant to us. And we will have a few people contributing to the conversation. So, how do we measure WASH systems change? These are what we call our building blocks. These are the actors and mostly the factors actually, but within them are actors that actually make the system work. Within the membership of Agenda for Change, we do have 18 global members at this point. We also recognize that our members themselves have different ways of conceptualizing and measuring systems. This is one framework for doing so. And on this slide, we have some learnings from the health sector. There is a lot of text here, so just to bring them together a little bit, when we look at the health sector for potential roadmap to harmonizing our understanding of the WASH system, we can see that there are some common monitoring and review frameworks, and a core set of indicators you will see in the middle right has not yet been developed and agreed. So there is no consensus yet on how to measure impact towards WASH system strengthening, but we are in the process of developing that now. So the building blocks are where we're starting with that in mind. And within those building blocks, there are still questions that surface on how to measure changes. And that's part of what we're going to discuss today. We're going to tackle two key questions during this session. Firstly, how are our members measuring changes in the WASH system over time? And then taking it further, how are those changes being implemented? Are they sustainable and resilient? And how do we measure that resiliency over time? Okay. This is our agenda for today. First up, we're going to have a virtual presentation from our colleague Rodolphe, who's going to talk to us about the Rana WASH Consortium in Madagascar. We're going to have a Q&A after that, and I believe my colleague Harry Sue will take your questions. And then I will present a study on research synthesis that we did towards this topic. And we'll have a Q&A, and then finally a panel discussion where a few colleagues will come up to share more with us. Are we going to be handing out?
Yeah, we'll just be handing out.
Okay, so you'll see my colleague Sarah and maybe a few others are going to hand out some colored note cards. So as we go through the presentations today, if you have burning questions, please write on those and pass them up to the front. And someone is going to help organize those for me. Good luck. All right, so we will get started now with the first portion.
Hi there, I'm Aguaconsult, the Senior Advisor for Governance and Policy at Water at Madagascar. Today, we'll be discussing the monitoring and assessment for system strengthening, focusing on the case study from the RAMOS project funded by USAID. Since Anwar started in 2018, basic drinking water access increased from 41% to 54%, and basic sanitation from 17% to 39%. Anwar was a USAID-funded project that was implemented over 6 years by a consortium led by CARE with WaterAid, Catholic Relief Service, and 2 local private sector partners, Pushpo and Sandadan. To increase equitable and sustainable wash services in 250 communes, the Ranwash project has 3 objectives: strengthen governance and monitoring, increase private sector engagement, and increase adoption of healthy wash behavior and use of wash products. Key results of the project included over 300,000 people with access to basic and safely managed drinking services, and almost 750,000 people with access to basic and limited sanitation. Ranwash was designed around the SWA collaborative behaviors and the wash building block. We used and adapted the building block framework since 2019. We used the building block in several different ways. As a tool, the project to benchmark, analyze, and measure progress and change at national, regional, and local level. The project also used the framework to evaluate progress of specific outcomes of interest, including private sector engagement. Lastly, the building block framework also allowed us to keep a global view on multiple blocks and relationship between blocks and actors. These ensure we did not overlook or leave certain building blocks behind. This slide shows some of the indicator and key changes in the wash system during Ranwash. These include 142 communes that increased their wash budget, which represents changes in local level finance and strategic planning building block. Another example is the national coordination body that was particularly effective at the regional level, which represented progress in the sector coordination and integration within block. The first method Ranwash used were early participatory building block assessment. This annual discussion among stakeholders provide a regular record for reflection, action planning at local level to strengthen the wash system. Participatory building block assessment can introduce concept of system to stakeholders who are less familiar with thinking in this way, and talking about system building block helps to make the intangible idea of a system more tangible and can provide useful framework for building shared understanding among stakeholders about what they need to do together to improve the system. Comparing building block assessment result over time can help to demonstrate changes in the system and contribute to evidence of the impact of system strengthening. The second method we used were quarterly progress monitoring of system actor and process at communal level. By actor means wash common technical agent, wash service provider, mayor, civil society, and local consultation structures. By process, we mean common wash development plan, sector function like budgeting, planning, and monitoring, and accountability mechanism. The objective of this method is to equip system actors with real-time performance and reflection of their activity at the common level, and to review, reflect, and adapt of project activities and support that is responsive to the progress and needs of each system actor and system process. For example, in the graphic, you can see that from the 250 communes where we work, the number of communes receive training around local consultation structure in dark blue, the number of functional local consultation structure in green, and the number of communes that have achieved quick win during the quarter in light blue. An example of quick win is a local consultation structure that successfully advocated to the commune for proper access to restaurant facility next to food stalls in the local market. This monitoring system includes 3 phases: setup and high-level support phases, evaluate the progress made in setting up and providing high-level support. Operationalize parts of process and or structures, assess the operational readiness of process and structures, results production phase or service improvement or enhancement factors, review the achievement of results concerning service improvement or the enhancement of factors. These assessments are valuable tools for fostering the dynamism of this process and factors, enabling adjustment to the support and identifying best practices and challenges encountered during the support implementation. They become particularly beneficial when complemented by narrative detailing quick wins. The third method was a more in-depth analysis and research of the changes brought about after several years of experimenting with the theory of change in terms of scale, ownership, and resilience. This research was conducted by the Agenda for Change in collaboration with Aguaconsult and Springfield Center. The changes to be measured to require time and may reveal weakness that needs strengthening. The results are notably contingent in the duration during which the undertaking efforts have been in effect. This was useful as an adapted methodology, especially for key changes in specific themes. In the case of FramWash, this was undertaken to gauge the extent of transformation in the sector to encourage private sector involvement in providing water services. Alec from Agenda for Change will also discuss this in the next presentation. In using this different methods to measure system change, we encounter several challenges. Ineffective decentralization contributes to turnover among system actors like mayor, wash common technical agent, that require additional time and resources on reintroducing concept, training, and knowledge. Ineffective decentralization also affects financial resources available to system actors to enact and lead changes. Using the WASH system and with the block requires demystifying concepts like system strengthening and private sector engagement. This requires a lot of dialogue with system actors and project staff. Building block self-benchmarking method can be subjective, so there is need to have strong facilitation to encourage critical self-reflection. Real-time indicator performance is needed to help contextualize and reflections on building block or quarterly actor and process monitoring. More time and focus is needed to increase the capacity of system actors to use finding, to enact adaptive action, and develop a result-based culture. 5-year project cycles make it difficult to capture long-term impact. Canwash closed in July 2023, and the team reflect on challenges and lessons learned to develop recommendations around improving the wash system in Madagascar. This includes ensuring intervention operate at national, regional, and local level. The importance of collaborating with cross-sectorial ministries, including Ministry of Education, Public Health, Finance, Decentralization, and finally, tackling the finance block. The capacity building and learning culture among the project team and wash sector actor was also key to promote changes in the system. This included participative assessment of system change using building block during key evaluation and reflection periods, like midterm reviews and sector reviews. Regarding the monitoring and measurement of system change, we learned that utilizing diverse program metrics to gain varied perspective on change is important. This can include different over time, which measure changes quarterly, yearly, or over several years, or different in application, measuring wash system progress at the common level for water sanitation and hygiene, and measuring progress in the wash system related to specific target or project. We can have self-diagnostic or implemented by external stakeholders. Self-diagnostic can enhance the adoption of wash system picking by stakeholders and encourage them to implement management adaptation. Engaging external perceptions can help rectify misperceptions while reinforcing the frequency of dialogue to facilitate perception adjustments. Encouraging to use of short-term measures and goodwill to expedite short-term performance improvements by established structure and identify collective support action. Aligning self-diagnostic cycle and the development of management adaptation measures with planning cycle should be a component of regular planning cycle. And each tool has its limitation, and the wash system changes are complex and may take time to ensure sustainable adoption. It is through successive iteration that the right decision can truly be made. Thank you for listening to my presentation.
Does anyone write any questions on the budgets, or we can just hand the microphone around the desk? Yeah. Okay. Okay, hi everyone, I'm Arsu. I'm from Madagascar. I was working with Rodolphe during the Urban Wash project as a senior behavior change advisor. And now I am the senior wash systems advisor in CARE International. And I am here to handle and answer your questions if you have questions or comments on the presentation made by my colleague Rodolphe. Unfortunately, he couldn't make it, but we should have been here together. So,
Any questions?
any questions?
I'll bring you the mic.
Okay. My name is Taman Taka from the for Millennium College. My question is, thank you for the nice presentation. The one simple question is, how do you measure? In terms of qualitative measures, it's fine. While we intervene in system strengthening, how do you measure service level improvements that you are implementing in a certain quality?
Will you come back to the question? Oh, yeah. So yeah, I'll get one more question back to.
Thank you for that, Mr. President. I'm Nicholas from the Thailand. First one, how do you comment on the validity and the
No, not really. Hello. You have to hold it very close to your mouth, I guess.
Thank you. Thank you so much for the nice presentation. Just three questions for class. The first one is what do you comment on the validity and reliability of data in connection to the building block analysis to measure progress? Second, and one is any limitations that you have observed in using building block analysis to measure progress in terms of what is done. Thank you.
So validity is one, and then also you got
But the validity was second one.
and also measure using building blocks to measure.
Limitation.
Oh,
Limitation.
I think it might actually help to take your post-its if that.
Hi, Will Phillip from South Africa. It'd be really interesting to learn a little bit more about that method 3 in terms of the how you track resilience of change and ownership of change. Just to hear a little bit more about that and how academic it went versus kind of practical it went would also be useful in terms of reflection. Thank you.
Does anyone else can manufacture and has one other colleague of practical?
Thank you, and UNICEF. Just if you could comment on attribution of a specific intervention to the final results. I mean, that's quite interesting to learn if improved coordination has any effect on if there's any comment around that or any thought around the attribution of specific improvements in the wash system or final result. Thank you.
I'm going to take one more and I think that will happen.
Point one is the baseline. You presented baseline for coverage, and I was wondering the baseline for the other building blocks that information. And then the second point has to do with the progress monitoring. I think you focused on September 2021, March 2022. Why that short? Another both side.
Okay, so for the first questions about the qualitative and quantitative measures. And so how do we measure change in service coverage resulting from system strengthening? So I think that is also similar to the attribution. We had evaluation and monitoring system, separate evaluation and monitoring system, measuring indicator service coverage, such as number of people having access to basic drinking services, number of people having access to sanitation, by basic and limited sanitation services. And we can, because we are monitoring each communes and the progress made by each communes, and then we can link these results to the performance on indicators like service coverage. So when we had like good performance from one commune, and then we can also see that these communes were really performing like in coordination, in planning, in financing. So we can have this kind of connection as we have good level of services. For example, in some communes, there were private partnership, public-private partnerships, and private sector were managing the water systems. And in these communes, when they are very performing, when they are well performing with a very good interaction, relationship between the communes and the private sector, and then we can see directly the results in the water coverage, access to water. For example, also in the sanitation, we had really supported communes in leading the sanitation activities. And as part of the system strengthening, we tried to support and develop all these building blocks like finance, coordination, planning, service delivery, and also working with private sector, working with local masons. And then we could see direct results in the number of people having access to basic sanitation services. So these are when we were really having these building blocks successful in the communes, we can see the results in the number of people having access to basic service, water services or basic sanitation services. And in on the contrary, when the communes were really performing like badly on the systems, no coordination, no leadership, no ownership, and then we can see that they don't perform well in coverage, in service coverage level. So that's why we are really promoting this system strengthening, because we can see when the communes are really strengthened, and also when they are supported by the regional actors and the national actors, mostly by the regional actors, because we had regional structure for WASH coordination, and they are leading the discussions on WASH between maybe 50, 60 communes. And when there is strong regional coordination, the communes are likely also to have better results in service coverage. So these interrelations and this connectedness between the communes, regions, and the leadership of the mayors were very key to improve the service level. I don't know if
yeah, correct. But one follow-up question. If a community as a baseline was before the intervention have X number of communities benefiting already, after the intervention of system strengthening, can you say this number of people have benefited out of the intervention? Can you do that also?
Number of people benefiting for the sorry.
Well, we're going to talk a little bit about this too in the next presentation.
And the panel too.
Well, we're going to try to link your questions together about service delivery and systems.
Okay, so another question is about the validity and availability of data from building block analysis, limitations in building blocks. Okay, so it was said during the presentation that when we do the building block assessment with stakeholders, it is quite subjective because people are assessing themselves like we planning, we are here red or green or orange. So there is some kind of subjectivities. And the exercise is to promote these self-reflections. And so that is kind of the limitation, if we can say that, on the building blocks. But another limitation is also the when we are really focused on each building blocks, somehow we might lose sight of the big picture because we are too focused on each building blocks, and sometimes we can forget about the interconnectedness between those building blocks. And that is something, because we were really focused on how about finance, how about planning, how about environment, how about behavior change, but then they are all interconnected. And then people, we need to always think of they are working together, they are, we need to have them strengthened together because they are always linked. And so that is kind of the limitation, one of the limitations is because it's subjective somehow, and because when we have these parts, we might lose sight of the bigger picture. However, we really need to have these parts because if we don't have these, we might also forget about some factors who are really important.
I think we're running a little bit short on time. I think we touched a little bit on the attribution, but the next presentation and the panel will, and you didn't keep track of some of this stuff.
All right,
Hi
so
there.
transitioning to the next portion of our presentation. I'm going to talk about a bit of research that was conducted for Agenda for Change by Aguaconsult and Springfield Center and some of the key findings. And I think this will help answer some of your questions on the first portion of the presentation as well. So our hypothesis going into this research was that wash system strengthening does in fact lead to improved service delivery. In the first phase of this research, which you can see was conducted in 2021, there was a self-reporting done across our members. I believe 12 out of 14 then members contributed to a series of in reports and questions around what they were measuring, how often, and what we found overall is that in many cases, they were either measuring one or both factors. So measuring system strengthening by itself or measuring service delivery outcomes by themselves, but there weren't very many links between the two. So in the second phase of the research, which is more recent, and this is what we're going to be focusing on today, this was an opportunity for us to go back to those the documentation from phase one and actually probe further into the data that was provided by a few members to test a theory of change that we hoped would link system strengthening approaches to improve service delivery. So today we're going to hear a little bit about the methodology first, and then I'm going to give you a brief overview of the 3 case studies, which were from Cambodia, Peru, and Madagascar. And the ultimate goal of this research was actually to provide guidance that was practitioner accessible for organizations and institutions who are using systems approaches for not just WASH, but development more broadly. So the methodology, the researchers used a theory-based evaluation, and this draws heavily from something called contribution analysis. This is not a statistically significant approach. We do not have agreed upon indicators for measuring this. So this was a best approach for how to do this. And the researchers were trying to explore the links between what selected members had done to strengthen systems. So what were the key activities? What was the result of those activities on the system? And the way they did this was by looking at actor behavior and factor performance. and how those two impacted on service delivery. So then you work down further in this graphic and you look at how resilient those changes were over time. So these are the key steps that they took for each of the case studies. First, they needed to define the service delivery system or subsystem, and they did have data from phase 1 on 9 sub-factors, I believe, that members were already measuring. So here it was just a process of prioritizing those factors. And once they did that, they worked to define a much more specific theory of changes that had already occurred over time. And this was helpful for them to kind of focus in and limit what they were looking at and what had changed solely at the time of the assessment, right? Then they developed a list of questions or indicators along the theory of change, and they tried to show the depth of scale and the sustainability over time. And then you get into the analysis of what changed and why. I'm going to talk about that, and then writing up and sharing the findings. I know Rodolphe also presented this theory of change. So just to say here, this was one of the key outcomes, and this is in each of the case study reports. But you can see here the links between the behavior changes and the performance changes over time. And then you'll notice that there are stoplights next to each of the key behavior changes. And from top to bottom, those represent the ownership, the scale, and the resiliency of those changes. And again, this is that subjective measure of red, green, yellow, but this was a best effort to link those key behavior changes to those scale, ownership, and resilience factors. So with a little bit of the methodology done, I'm going to jump into the case studies. So the first case study was based in Cambodia, and this was focused on the work of Watershed. Before starting their work in the mid-2000s, baseline sanitation coverage in the country was around 30%. So for this case, the analysis focused on product development, targeting of sanitation promotion, and leadership skills of local public officials. So it was important to note also that Watershed worked with a range of private Cambodian agencies and enterprises and public authorities at different administrative levels. So through their own monitoring over time, and they had quite good monitoring, they noted that local elected leaders were critical for actually delivering improved rural sanitation. So what Watershed did was they actually pivoted their methods halfway through and started targeting those local leaders to actually deliver the sanitation services and get that uptake to increase. So they developed and tested a training package, and they spent a significant amount of time working with a couple of different national agencies to actually embed that into institutions, budgets, and processes. So over time, they reached quite impressive service delivery gains. You can see they jumped from 29% at baseline to 77%. And there were positive signs of ownership. At the time of this analysis, they actually were in the process of doing a full-scale adoption and rollout of this training. And Watershed actually exited the sector strategically after completing their 10-year plan in 2021. So part of that resiliency was actually handing this training package over completely to the national government, and they have taken that forward with technical support from existing partners in country. Peru was the second case study, and this looks at the work of Water for People in a rural district called Asunción. They had worked there since 2013. And baseline coverage just for water, we're talking about water here, was at 83%. And here, the research is focused in on planning and finance for sustainable services. And even though this district was at this boundary was at the district level, Water for People also worked with the national regulator and subnational agencies. What were some of the key behavior changes that were noted? First, the district government collected information. They did a survey of unserved households for the first time ever. They used the information that they received from that household survey to then plan and finance a universal coverage campaign. And that actually quadrupled their funding for wash services from $15,000 to $70,000 over 6 years. So you can imagine that that funding then increased the quantity, the quality, and the diversity of technical support, including hiring more technical staff to deliver services and training in the region. In terms of the scale of this, Water for People has their own Everyone Forever model, and they were monitoring this over time. So they reached that Everyone Forever, or EF, milestone in 2019. And a really interesting scale-up process was underway at the time of this assessment. All of these changes taken together contributed to a significant reduction in the percentage of unserved households. So it was down from 17% to 3% at the time that this was done. And finally, the last case, which is Rana Wash in Madagascar. This is a consortium of 3 Agenda for Change members, and then there are 2 other private sector and maybe even government actors as well. And this focused on one of the 6 regions that Rana Wash was working in on rural water supplies, specifically being supplied by private water operators. So the baseline coverage was 1% safely managed and 12% basic. Given the need to persuade and enable private sector participation in rural water, Rana Wash was almost required. Yes, I would say they were required to work at multiple administrative levels simultaneously. And as a direct result of updated national contracting, targeted advocacy, the subnational governments actually began tendering for private operators to implement a management model that was called Co-Invest, Build, and Operate. So taken together with behavior changes at different levels of the system, 8 new water systems were constructed, serving an additional 66,000 people. At the time of this analysis, the ability of private water operators and the local government to sustain these practices over time was less certain, specifically given the importance of partner funding and unlocking that private sector investment. It was not clear who was going to play that role going forward. All right. So now you have an idea of the 3 case studies in quite different contexts. So we're going to take a little step back and we're going to look at common patterns and lessons that emerge across the 3. So the top portion of this graphic is depicting opposite ends of a spectrum, from broadly easier to work in on the right to more challenging on the left. So that's the top level. And then the second level is that we found both evidence of direct service delivery where members intervene directly to strengthen aspects of the system. And then on the opposite side, there was a focus on enabling permanent actors. So that would be the governments, the private sector, and others to then enable these changes. So that was more of a facilitative role, if you will. Finally, we saw varying degrees of ownership at different levels, and some of those could not be fully tested because the actors were and possibly still are engaged in building resiliency over time. Building on the prior slide, what we have here are some top level findings. I don't think many of these are going to be surprising to a lot of you, but in terms of context, the main lesson here is to be realistic in terms of what can be done in each environment you work in. We obviously have 3 very different contexts. And the key message for me here is that system strengthening in a challenging context is possible, though you do have to be realistic about what that's gonna take and the extent of the change and how long the timeline is going to be. The second point around collective action, across all three cases, our members work collectively with other entities. And that helps like build this collaboration and this system strengthening over time. The third point around pathways to scale, these were not directly linear. And organizations worked at different levels depending on how their attempts to strengthen the system unfolded. So you need to be flexible and you need to have the ability to make changes as you go, which links directly to funding, which is our next point. What we saw quite markedly in 2 of the 3 cases was a larger number of flexible funding sources. So that enabled this ability to adapt, to make changes as you go, to have autonomy. And that is certainly a critical lesson to take away from this research for donors and how funding is approached. And finally, linked to that as well is the time that all of this takes. And across the 3 cases, we found that it was at least a decade or more. And that includes changing the behaviors, building the architecture that actually allows for those changes to be adopted, embedded, and resilient over time. So a 5-year funding window or a 3-year funding window is not going to help us to really deliver this work. What we need is some patience from donors. We need longer, flexible funding windows. And this is the last slide. These are the reflections on evidence into use. So some questions that I can actually answer. So how can these lessons be used to advocate for more investment? Firstly, understand the environment that you're going to go into, the context, be realistic in terms of what you can and cannot do. Have clear organizational strategies for how you approach system strengthening in terms of your role as an institution, how you work with government or the private sector, and be very thoughtful and explicit about how you understand your role in that process. Lastly, on the first question, be very clear in the design phases in that dialogue with your supporters and partners with your donors about what this work actually entails, especially around the funding and the time windows that this is going to take, and that you need that flexibility to be able to deliver this work. In terms of documentation, the researchers have said that having consistent monitoring data around the strength of the system over time is very important from the start. So if this is something you're going to do, that is definitely data you need to start logging and saving. Certainly being explicit about how you see your theory of change so that you have a clear pathway to reflect on. And finally, being open about documenting what doesn't work. As much as we document what works, let's be open about failure. We come across challenges at times, and it's very important to learn from them as much as possible. And especially what you learned and how you would have changed your efforts so that others can not repeat the same mistakes. And sharing that with the sector is even more helpful for moving us all forward together. So that is the end of my presentation, and I'm happy to take questions. Meryl, I might need your help.
Yeah, thank you. My name is Amara from Ethiopia. I appreciate the nice presentation that you did. I have only one question. From your final slide, you concluded or deduced that the time required to achieve systems reusing outcomes, including service delivery, is about a decade.
10, yeah.
Yeah, so I'm wondering how you actually come up to that decision. And also I would like to know, what is the critical factor from the 3 cases that you already did is something, outweighing Is it the behavior or the actual quality? Because so that would be something that I'm looking to hear from TTO.
Anyone else?
Now, we need to point out that the study, that all this is available online on the website, so both were taking pictures of the slide.
Oh, yes.
Right? All of it.
So all of these case studies, the synthesis, the methodology replication guidance, and then also the phase one report are on our website. So if any of you are interested in reading those or actually looking at the briefs, I'd be glad to point you in the right direction.
Which website?
It's watchagendaforchange.org. We also have a booth here, so if you come see me at our booth, I can point you there as well.
We have one more question.
Hi, thank you very much. My name is Lisa from the SLPO in the UK. I was interested to know how often did you go back to your theory of change and kind of assess whether you were on the right pathways of change, and kind of your reflections on that process. And how did you manage the tension of kind of the regular reporting and needing to demonstrate change over the regular basis versus that longer term target? Thanks.
And I'll have one more.
Thank you for your presentation, Michael from UNICEF. I just wanted to ask, do you have any, just given all the kind of learning around flexibility and how much time it takes, do you have any kind of practical insights coming from the case studies with regards to planning and budget?
Okay, my name is Jeremiah Tengdam. My name is Jeremiah Tengdam. I work with IRC Ghana. I just wanted to also find, and thanks for the presentation, to find out because we've been doing some work at the subnational level in the Ahafo region. And we have found planning as a good entry point for system strengthening. And with planning, I'm referring to development of long-term wash master plans that will clearly articulate the key wash issues you want to address, how you are going to account for your collective progress, and also what behavior issues you want to address. So all that is encapsulated in the plan. And the plan usually is co-created, everybody commits to that collective issue. And we have found that we need to be able to amplify the collective action that is needed. And many partners buy into that and they are committed to it. I saw you emphasize a lot of the finance, but from our experience, the planning, starting off with planning really has been key to achieving greater results in system strengthening.
We only have a few minutes. Alex, if we want to.
Yeah, I think some of these questions are a little bit more methodological. So Harold, one of our researchers is actually here in the audience today. I think he can help with those.
Well, I'll do what I can.
Please, thanks.
No problem. Thanks very much. We'll try and answer different questions through different means. The time required when you ask how we figure it out is basically backtracking and looking at the program design, how long these programs have been active, and this was all done through the retrofitting. So this was a case study where we went back and looked at documentation to put in these projects and programs. So one of the issues was that they hadn't explicitly set out from the very beginning what we're going to do, how do we trace this, and somebody else asked about, I think Lisa, you asked about theory of change, there basically were none, there was no theory of change. So we had to go back, and this is really, my colleagues, Kate Ogelberg and Rachel Shah did the bulk of the work on this to really try and come up with a common way of looking at change over these quite different programs operating at different levels with different system boundaries. So that was how we came about looking at these theories of change. And it was a bit of an iterative process. So we had to go back and with consultation with these three groups, modify those as we work through them. There was a question around common factors of success, I think, somewhere over there. So I think one of the key things, especially relating to resilience, which was a question asked earlier, you know, that's probably the hardest part of it. So you can achieve and try and promote behavior changes as an external entity, but then making those sustained over time, making those changes resilient is extremely difficult because you're dealing with most of the people in this room are representing external agencies that come for a period of time and many years, every decade, but eventually your funding will change. You're dependent on the capacity, the vision, the commitments of often governments, but other actors in that system to keep those behavior changes going. So that's not a sure thing. I think the three things that were important for us when we looked at this around what influenced the success was really like the type of agency you're dealing with. They're not, you know, not all organizations are the same. Obviously, not all NGOs are the same. Some are better at some things than others. You really have to look at the capacity to address some of these systemic challenges at different levels. And often times NGOs don't have the capacity to do that. I'm not saying these three didn't, because they did some very valuable work at different levels, but you have to look at the capacity of the actor that's trying to instigate, promote, facilitate this change. The second important thing, I think Alec mentioned, it was funding. So where actors had very flexible funding that could change over time, they achieved better results than having a very rigid sort of flow of financing that had to be reported on, and it was difficult to change. And the third obvious thing is the context. I mean, you know, the Rana Wash projects was, I think they achieved a lot of things, but it's a very challenging environment. So you want to set up a private, you know, contracting model in a country that has very low levels of household income, it's going to be a challenge. So that was an obvious one you have to look, and that was what that graphic we tried to capture, you know, the low to the high resource, and it's rather obvious, you know, it's not. I would say in that sense, it's difficult to predict. What else for question?
Harold, one of the timing. Why did you settle on a decade or more?
No, somebody mentioned something about practical things, so I think that links back and maybe to the comment by Terry around planning and budgeting. So being flexible, being open about as an external entity, being able to be flexible with your funding, flexible with your planning, being adaptive rather than just having a to Z, you know, trajectory. Hopefully those answered some of the questions, but there are more.
I think some of the other questions we can also take in the panel, which I think doesn't be so much. So let me move this up. Thank you all for your questions. Just being mindful of time because we are in our last 30 minutes. We do have a panel planned next. So any questions that we have not gotten to, we can feel free to also ask our panelists. So I wanted to invite the three of you to come up here. Harry Sue Rasa Molina, she's the WASH Systems Advisor from CARE USA and CARE Madagascar. Julia Boulinoir from Aguaconsult, and Anna Leiby from Water for People. And I do not have a way of introducing you beyond your names and titles. So if you want to give us a quick bio before you speak, I would appreciate that. And here are the questions that we would like you all to tackle today. The first one, I think I'll just give them to you in bits and you can each take your turns answering them, is what do the case studies and your experiences tell us about trends? So in which block, I'm assuming building blocks, is system strengthening having the most impact, and the opposite of that, the most limited impact? So just going from you, Anna, since you're closest to me.
Bio and then the question, or just bio?
Just introduce yourself.
Hi, everyone. My name is Anna Leiby. I've been with Water for People only for about a year now, so I did check a lot with colleagues about the case study, but happy to take your questions. I don't know if the microphone really works.
The microphone
It's
is
very,
Do you want to come up here? Sorry to get you.
oh, is this better?
Okay, yes.
Okay. Yeah, real close. Yeah, before that, I was with USA Sustainable Wash Systems Learning Partnership while I was doing my PhD at CU Boulder and Wash.
Hi, everyone. I'm Julia Boullenoir. I'm with Aguaconsult. And I wasn't involved in the development of the case studies, but I've done some work around monitoring system strengthening. So I'll be talking from that perspective.
Hi again, everyone. As I said, I'm Ars. I worked with a work project for its 6 year of implementation as a senior behavior change advisor.
Try to hold on to the mic for a second, actually, because you actually were up here talking about a few of the building blocks. You mentioned finance, planning. I don't know if you actually mentioned monitoring, but so finance and planning, it seems to me, are two of the building blocks that system strengthening is having the most impact in for the Rana Wash project or in Madagascar. Is that true?
Yeah, I think sometimes when you think of the building blocks, you tend to think they are all important, right? But you need to identify which ones are the most important. And I agree with you, planning and finance, but I'd also say institutional arrangements where actors know what they have to do and they know how to do it, so they can have so they can lead the activities, lead the planning, lead how to mobilize finance. And one thing about finance is I think we need to be careful when we are talking about finance. It's not about necessarily increasing just the funding, but also how to support the actors to mobilize their own funding. For example, for the case of a Wash project, we supported communes to mobilize funds like local taxation. So these are part of finance, just not increase funding from dollars, but also supporting the actors on how to find their own funding and how to fund their own activities.
Great, thank you. Julia, do you have anything to add on building blocks that have, I guess, the most or least impact?
Yeah, sure. Thank you. So again, I think my perspective on this is not necessarily linked to these cases, maybe a bit more broadly. I'd say that it's a bit of a difficult question because it depends the time you're considering. And I would say that maybe the building blocks or aspects of the building blocks that matter the most, maybe around government leadership, around mobilizing government finance over time, are the ones that probably are the most important, that are going to take the longest to actually change. So you might not see progress if you're looking at a 2-year period, but if you're looking at a 10 or 15-year period, you might see a change and you might see the most important change. So again, it depends what time frame we're considering. If you look at how, like, a very superficial way of looking at this is looking at how scores evolve. So the green, yellow, red of the scoring of the building blocks, and you look at it at year 1, 3, 5, and you say what's evolving. I would agree. It's around planning, it's around coordination mechanisms, it's around monitoring. But again, I think there's a bit of a tendency to measure what we can act on and then act on what's within our sphere of influence and then report progress on what we can handle. So without wanting to limit the impact, I think, and that's maybe another topic, to maybe look beyond the building blocks to look at how the system is actually being strengthened genuinely outside of how we as external partners are supporting the system.
Yeah, do you have another recommendation to add on top of that, or anything in particular around the building blocks you can add?
Yeah, I guess in Peru, we really saw that institutional arrangements, planning and financing were really easy wins that also got people excited about intervening in the system and strengthening it because it's easy to then understand what's happening once you make that data available. But institutionalizing monitoring, I would say, was like a harder one that we saw happening. And now that's something we're really focusing on post this study, working with government-led monitoring systems in Latin America.
Okay. As far as learnings from other actors and sectors, how do we measure change during the system strengthening process? Any tips or best practices that you can share regarding that? I know, Anna, you just talked about setting up monitoring systems that matter for people. Do you have any kind of initial takeaway from that process? Like, what are the pinch points or what's been easier than you expected?
I think sector silos have really gotten in the way there. Because going to government, they only care about one thing in this department, they only care about one thing in this other, education ministry, the health ministry don't talk to each other necessarily. So coming up with like sector-wide finance strategies that include monitoring has been a real like learning opportunity, I would say. If that's also the building block that I personally focus on in my role the most. So that's my bias.
I think the health sector has developed a framework that talks not just about inputs, outputs, processes, but it looks at the outcomes of system strengthening. And I think that's definitely a direction which we should look to, and maybe I can share some news afterwards on that. But yeah, I think the health sector.
I also think because you presented one slide about what could we learn from the health sector, I think there's really something that we should look into on how to measure together and maybe to identify some core indicators to allow us to have a common framework on how to measure change. One thing also about learning, I think it's really important to emphasize about the learning process and how to give a space for all actors to learn together and to exchange, because there is the subjectivity, but also when we are talking and when we are exchanging, then we can realize, that was really the change that we wanted to make. And we need to give space to people to verbalize this learning, and then to give them space to talk aloud about these changes, and then to reflect. I think opportunities to learn are really important.
I guess we can just go right into our next question then. And I think, Julie, you might have been hinting at something here, but it's, can there be and should there be a harmonized framework and methodology to measure system strengthening and WASH? And the next question is, what can we learn from health and other sectors? So
I think I have already answered that question. So just to emphasize, I think there is really need to have something harmonized, because for the WASH project, we were kind of working on the building blocks, and we had our own indicators, and we were curious on how to are there other organizations doing the same thing? How can we compare with other organizations? How can we learn if we are doing things right, So I think a harmonized framework is really necessary to help implementers such as ourselves when we implement projects, to have this as kind of a reference. And if we are doing this right, and also for the actors at the grassroots level, to know that these are a harmonized framework that we are using along with other organizations to improve access to WASH services. Thank you.
Yeah, so the answer to your question is yes, we need a framework. We need a common framework, and I think we need it for lots of reasons. I think, first of all, all the organizations come at the topic of system strengthening with slightly different building blocks, or however we want to call them. They're mostly similar, but they're also a bit different, and it's confusing for government stakeholders, and I would say it's unnecessarily confusing. But also it links to the broader sector-wide agenda, the drive towards a greater emphasis on system strengthening. So I think having a common conceptual framework and monitoring framework, definitely yes. And I would say this framework has to look beyond the outputs that are currently in the building blocks. So looking at what are these vital or core signs that indicate a change in the system. It's something that I'd say is not currently monitored in the building blocks, whichever building block we're considering. And this is something WHO is currently looking into as maybe the next generation of glass. So looking at what these vital signs are, what are the key measures of a strong system to push the agenda forward, to drive collective action, and also to measure change on the way. But I would say if we are going to go down that route, then I think we need to maybe as a sector agree that we just drop this notion of attribution, because it's really not about that, and we're just not going to get it. So this whole argument of did this activity lead to this service improvement? Well, no, it probably hasn't, because there's a million other things going on at the same time, and there's lots of actors involved, and that's really not the point. So I think it's a whole culture shift in a way. It's not just adopting a new framework, but yes, we need it.
Yeah. Okay, so as the third panelist, I have to be contrary and say no. Even though as a member of the One for All Alliance, I think we are working towards there. Maybe we'll get there eventually. It's the first WASH sector alliance where we do have a shared theory of change and results framework. Systems will eventually be added to that, I think, monitoring, system strengthening together. But I also think that we don't want to jump too far into that, doing one thing the right way altogether, because then we'll absolutely lose the adaption part of innovating for WASH systems change. We'll miss out on opportunities to learn along the way, and there's no such thing as a perfect framework or methodology. We can see that from how quickly the sector has cycled through them. I don't know, maybe we won't be talking about WASH systems strengthening in 5 years. Maybe we'll be past that to like regenerative something.
Do you have any takeaways from the health sector that we can learn from? That was the last question.
Yeah, I just have limited experience with the health sector. I would say so, yeah.
Yeah, I mean, just to share a point on that, I think the lesson from the health sector is that they did not come up with a perfect framework, and that was not the point. They just agreed that they had to have a common way of looking at the problem, and that the solution was a framework. And the fact that they did settle for a framework that was very imperfect, but in a way, it sort of parked the question, and then they could focus on just joining efforts to actually do what was required to do. So I don't think the solution will be a perfect framework, and that's a clear lesson from health. I think another lesson is that it took time and it's constantly evolving, but in a way, the starting point was the agreement, and I think we're maybe not there yet. Also judging from the questions around attribution, and I will insist on that point because, yeah, I'll stop there.
Do you have anything else? Okay, Harry Sue. I had one additional question, which I'll throw at you and you can do the best you can. In addition to the production of evidence, which is obviously we're talking about evidence and impact today, what else do we need to be doing? I think particularly to persuade other institutions that are not using this collective system strengthening approach. I think most of us are the converted. We believe that this is a better way of working, but beyond evidence, what else should we be doing or providing to help bring those people into the fold? All right, so you were saying something about lesson sharing, which I think is along the same lines of what I'm talking about.
Yeah, I think lessons, I was talking about providing spaces for lesson learning. Yeah, that can be something that we could develop apart from evidence. And maybe also not just at national level, but at local, regional, national, but subnational, but also at international level. That is really important.
Can you repeat the question, please?
Yeah, so I'm just thinking a little bit just beyond the evidence and the impact, which I think we're all very comfortable talking about, and we're trying to tie outcomes together, but I don't know if that always connects with other parts of the sector, or other institutions that aren't necessarily working with a system strengthening framework, no building blocks in mind. They're just kind of doing what they've always done. So how do we bring them in beyond, giving them hard evidence?
Yeah, I think maybe a few ideas here is, first of all, working on our communication. So trying to think of simple ways of communicating the concepts around system strengthening. Because I think we have a tendency to be very deep into our own little bubbles, but finding a way to show what system strengthening is, what it looks like in practice, what are the results of system strengthening, without showing a pump or a pipe. I don't have the answer, but I think there's something around that. I think we also need to dig deeper and demonstrate that we understand that the system is not just these building blocks. It's actually around deeper governance issues, public finance, administration, procurement that are way beyond the wash sector. And again, because we measure what we can influence and then we show progress on what we can do, we kind of ignore that the system is way bigger than that. And I think that affects the credibility, actually. So there's simplifying and complexifying our understanding, I think somewhere there. And maybe thinking about ways of documenting how we strengthen the system in a learning and collective way.
Yeah, similar to that, I think we can use more open, inclusive, like participatory monitoring tools when we're trying as water for people is outcome harvesting. So looking backwards at the system's change and not really like being limited to our theory of change or what outcomes we're expecting to see, but anything positive, negative, intended or not. And then those kind of make nice little stories of change that I think are easier to understand and digest than like, here's a building block and here's a number and here's what that means. So yeah, doing a little bit more of that.
Yeah. Yeah, I would like to add that the wash sector is influenced by bigger issues. And I'd like to emphasize on the centralization process, especially in a country like Madagascar and maybe in similar African countries where the power to decide and power to do everything is really centralized at the national level. So we really also need to strengthen this other process like decentralization, because the systems at local level, actors won't be able to change anything if they don't have the power, the control, and the resources to do these changes. So we also need to be aware of this bigger issue. And for me, I think maybe that's Madagascar case, but decentralization is really key if we want to influence the systems strengthening process.
I see a hand up. We can take some questions now from the panel.
Yeah, I just wanted, my name is Elijah from Wotay, Southern Africa. I just wanted to add something about which system strengthening building block is the most important. This is actually based on the context. The reason why I'm saying this is we did a system, strengthening building block planning, the strategy in Malawi. And then we were looking at the context. So in the context, which one is the most important one? You find that based on the context in Malawi, we realize that sometimes the performance monitoring is not important. And even gender indicate, was not actually, an institution was not important. What probably was not, even the finance was not important. The finance is there, but the way it is utilized is different and how it is actually going on. So what really came out was the leadership and maybe a bit of the area around the strategy and plans and so forth. So I'm just saying we can't generalize to say this all over, this is finance is the most important. No, it's based on the context, and if you do the planning and you dig deeper within a specific context, you will find that it differs in different building blocks with differ in terms of which one is important and which one is the least. And it's very easy to select them if you are actually on the ground and you are doing that planning. So that's something I wanted to add. The last thing, just quick one about how we use the framework for system strengthening, how we measure that. In water, we have two systems. I'm promoted because actually I led in regional level, I led the run wash. We designed it and I've been supervising that. So I'm so surprised to find that it's here. So that's good. So the way that we measure the system strengthening in terms of indicators, we have two aspects. So we have the direct beneficiaries, the direct number, the number of people that are actually planning the project, which are benefiting. But we also have the indirect measurement. So the indirect measurement, what happens is that if you have a district and you have done system strengthening building blocks, and there's some improvements in planning, in finance and all that, and you can easily look at the number of people in the district, how many are they, and then you can then estimate either 20% that are actually accessing that within the district, and you can actually attribute that to, if the system strengthening building blocks have improved, then you will be able to have some percentage proportion of people that probably indirectly are actually benefiting as a result of all these building blocks in that district that have improved. So that is one way also we have been trying. But I agree, we need to have a harmonized framework. I think that is a very important thing.
Do any of our panelists have reactions to that? No? No? Take more questions. Well, no, we do have only 5 minutes, so
Okay.
try to keep it to a question.
It'll be a brief question.
Okay.
Okay, I'm R.C. Crawford. I'm with 1 Million Wells, and I started chasing water for the world about 1977, when there were 300 million people in Africa without water. And today, with all our progress, we have 400 million people without water in Africa. 6,000, I think 4,000 people a day dying from bad water. And there was a discussion about change. I have a patent, I have several well drilling patents, and I haven't found an organization yet that's willing to change the methods that they're using. Even though we have more people dying now than we had in 1977, would any of you three be interested in cutting the number of people dying each day? Or do we want to keep having that same number of people dying? Because I haven't seen any good change.
We'll take a few more questions.
Louis Borston from the Osprey Foundation. The gentleman from WaterAid, I can only agree with you. I think the framework is very useful for diagnosing what's going on, but the point isn't that you should do everything everywhere. It's to use it as a method of diagnosis and then decide where you need to focus. A question for the panel, please. Julia, you said that that we should not be trying to connect system strengthening with better service delivery. If that is not what we should be doing, what does it take to get governments and large funders to decide that supporting the system strengthening approach is the right way to go? I've been going on the assumption that it would be helpful if we could have good evidence that connected system strengthening with more sustainable service delivery. But if that's not what we're after, what is it that's going to get the government of Madagascar, the government of Malawi or anywhere, and the large development players to say, yes, this is the right way to use our money?
Thank you. So, Jeremiah, I asked my quick question to the panel also is, we know whose systems are we strengthening, and it is the government systems that we all want to help strengthen. And we know we have different capacities and interests here. It's not all of us that we all don't work on all the building blocks. Some of the building blocks that we have competencies in, we have the resources to do. And I think overall, the government leadership that has to be strengthened so that they can have a hold on everything that's happening in the system. Because we all go preaching system strengthening when we know we are not going to be able to cover all the building blocks in the system. We definitely need collaboration, partnership with others who are working in other areas of the world system. Then collectively, we can make those big shifts that we want to see in the system. So I'm wondering whether in every system strengthening endeavor, we could have like a hub organization that drives that process. Then that then can rope in the others, those who are doing the service delivery, those who are doing planning, institutional strengthening, coordination, learning and adaptation, and what have you. So that if you have one coordination point that works with government to be able to drive, and then the rest can fill in the other gaps. Otherwise, if we are all preaching the same thing, then it can bring about some confusion and what have you.
Okay, yeah, a reaction to several of those questions together, I guess, in the interest of time. I think we do see evidence, we're starting to see evidence of system strengthening affecting service delivery levels. I think that was the whole point of the case study on Asuncion. We did see evidence of that prior to even beginning the study. That work in planning and financing led to improved service delivery levels, and that was part of our systems approach. It's always going to be a contribution, not an attribution, right? So as we evolve our methods, we evolve consulting other sectors on how they measure this too. I think we'll continue to see improvements. I'm still a believer in the approach, so yeah.
Thank you. I'll respond to your point, Louis. I think we do need to convince stakeholders that a system strengthening centered approach makes sense, but at the same time, I think it's common sense. I mean, you look around, the countries that deliver high services have strong systems. So in a way, what I'm trying to say is, I think we need to put more efforts into showing the way to strengthen systems and progress along that way. So what are the vital signs that a system is getting strengthened? What are the steps on that way? But I think this obsession for trying to demonstrate an attributable link between system strengthening activities and direct improvements in service delivery, I don't think should be our priority. And that's my perspective.
About government and how to influence and or how to make them adopt the system strengthening, or maybe how to use their resources better. I think maybe we need to convince them, but also when we need strong facilitation skills, because when we ask the right questions and when we make people reflect, I think they will say that is the way to do things. It is just because sometimes we sometimes we might impose something, but the actors are not ready yet to adopt. But if we focus on facilitating, on asking the right questions, such as, okay, you think you need to fund to build more infrastructure. That is always in the water sector. Just build water systems. When you come to some governmental official, they are asking, okay, you are working in water sector, how many water systems are you going to build? And maybe the question to ask them is, how many water systems are not working right now in your country, in your district? And why are they not working? So when they reflect and when we are asking the right questions to people so that they can come up to the answers themselves, that would be very helpful. But and I think these facilitation techniques and these facilitation skills are not maybe not everyone can have them. Somehow, maybe we just say we are going to do this. But this conversation we need to have with the government and to bring them to reflect. And I am sure if we give everyone opportunities to reflect, they will come up with the answer themselves, like, yes, system strengthening is a way to move forward.
Thank you, Anna, Julia, and Harisu for your time and for answering questions. That is the end of our session today. Again, if you would like any information on the case studies or the synopsis report, please talk to me. No, we were just like talking about you and I was like, I haven't seen her and I think I know what she looks like, so.
Yeah.
Glad you called me.
What booth did you say you're in?
We're at the agenda for change. Yeah, if you go towards the lunchroom and turn left, we're like the first booth on right.
I'll look for you.
Okay.
Thank you.